All right, let's go ahead and begin. Welcome, everyone, to today's Private Well Challenges Roundtable discussion, which is part of the Private Water Network's A Year Since Launch event series. Thank you for joining us. My name is Reem Tariq, and I'm a project coordinator with the National Environmental Health Association. I'm also serving as the lead administrator for the Private Water Network. Before we get into the details of the roundtable, I would like to address a few things about the network. If you're not a member of the network and you're curious about learning what the network has to offer, um, then let me inform you that the network is a virtual community of public health professionals and safety workers that work with private drinking water systems. The network was launched by NEHA in partnership with CDC and NNPHI back in 2019. The mission of the network is to build a sustainable community for those working to support private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing and emerging issues, and to build capacity to do the work more effectively and efficiently in order to protect the public's health from contaminants and private water sources. Membership to the private water network offers access to the virtual community platform, which offers features such as a discussion forum, a resources library, an events calendar, and a member directory. Also, just to highlight very quickly that this is a free resource to anyone who would like to join. We do ask people that are working with private drinking water systems to join. And now on to the roundtable. So, the title of today's discussion is Private Well Challenges. The three challenges to be highlighted in this discussion are data gaps regarding private wells, effective outreach, and treatment concerns. We have a speaker for each of the aforementioned challenges, and each speaker will give a short primer for up to 10 minutes on the challenge that they will be covering. So, to address the challenges around data gaps with private wells, we have Dr. Max Zarate Bermudez from CDC, who is an environmental epidemiologist at CDC's National Center for Environmental Health. Dr. Zarate Bermudez has been working in safe water and wastewater management projects and programs throughout his professional career since the 1990s. His education and training in water quality management was done at University Mayor de San Simon in Cochabamba, Bolivia, at the and at the University of Surrey in England. His training and education in wastewater management and environmental health science was done at the University of California, Berkeley. He developed and implemented drinking water quality monitoring programs in rural Guatemalan town and in Bolivia and consulted in wastewater management projects in Bolivia in the early 2000s. In addition, he developed and taught graduate and undergraduate courses in safe water, wastewater management, and environmental health sciences as at East Carolina University between 2004 and 2008. So that's with Max. And on to the next challenge. To address challenges around effective private wells outreach, we have Lori Reynolds Rardin, who is a research translation coordinator at Dartmouth Toxic Metals Superfund Research Program at the Dartmouth College. Laurie has worked in the environmental public health communications field for over 25 years. She is accomplished in bringing stakeholders and community partners together to reach common goals, particularly through the facilitation and organization of the New Hampshire Arsenic Consortium, and has worked extensively with the New Hampshire Department of Environmental Services and Health and Human Services and the U.S. Geological Survey, as well as the EPA and other partners at the local and community level to address the issue of arsenic in private wells. She has facilitated communication of mercury science to inform policy audiences regionally, nationally, and internationally, and she led the development of Arsenic and You website, which provides a comprehensive information on arsenic in water, food, and other sources. So that's with Lori. And to address the challenges around treatment concerns, we have Pierce Rigrod. Pierce is a supervisor at the Drinking Water and Groundwater Bureau at New Hampshire Department of Environmental Services, which is New Hampshire's primary state environmental agency, where he oversees source water protection programs designed to better protect local drinking water resources. Pierce also works on the agency's private domestic well initiatives and managed the development of New Hampshire's Be Well Informed online tool that allows private well owners to determine the most appropriate water treatment when water testing is done at lab indicates the elevated levels of arsenic or any other contaminants that may be found in well water. This online tool is now being adopted or considered in at least 12 other states. Pierce holds a master's degree in regional and urban planning and has worked at New Hampshire Department of Environmental Services, Drinking Water and Groundwater Bureau for the last 15 years. And he has served on a number of local boards and most recently was elected House board member for the Conval School District. So before we get into our roundtable and the primers that our speakers will be offering, I would like to go over some quick housekeeping rules. First off, let's try to introduce ourselves since this is a rather small group. I would like for each of you to say hello to the group by typing your name, organization, and location if you're comfortable into the chat box. Um, the other item is please note that this is a 60-minute roundtable session. We will reserve up to 30 minutes to hear from the speakers on each of the assigned topics and then move on to the discussion portion for the latter half of the session. We are hoping to have a very interactive roundtable discussion, so we highly encourage our participants to engage in a lively discussion. So each of our attendees, you may raise your hand to have the host unmute you on Zoom. We could do that. Or if for any reason you're not able to speak, if we've tried doing that, then please try to engage using the chat box, or you could even drop in your questions using the Q&A box. So there are lots of options. Choose whatever you're comfortable with. This session is being recorded, and the recording for this session will be uploaded onto the Private Water Network's resource library. We will also share any links to the resources that may come up during this discussion, if any are mentioned, via a follow-up email. And lastly, at the conclusion of the session, you will be directed to a short evaluation survey for the Private Water Network's annual evaluation. So please do complete that brief survey. Should not take you more than 2 minutes or so. And that feedback that you may provide is quite valuable for us. So please do so. And with that, without further ado, let's begin with our first private well challenge, data gaps. Max, the floor is yours.
Okay, I check that I am unmuted. Thank you very much, Reem. And thank you very much to you and all the organizers of all the events celebrating the first year of the Private Water Network. On behalf of my co-authors for this short presentation at the CDC, I want to also wish all the best and success to the network in the years to come. This presentation will focus mainly on work that has been done over the years at the CDC, and we are happy to share these identified gaps, data gaps with the audience of this event. Next slide, please. This presentation will cover 3 data gaps identified during the conduct of the CDC's Safe Water for Community Health Safe Watch program, which I understand many of the participants of this event today belong to between 2015 and this past August, and also is based on a literature review. Why are we looking at these gaps? At the CDC, we are trying to close data gaps by getting better information in each of these areas to help private well programs at state and county levels to better outreach private well owners and other stakeholders. Next slide, please. There has been no method used to calculate the proportion of people using wells in the United States since the conduct of the US Census of 1990, which was the last census that collected information from US population directly about the water source that they were using, among them private wells. The following is currently available regarding population estimates. In the year 2020, USGS estimated the number of users of private wells in the country in 40 million people. These estimates were done for the years 2000 and for the years 2010 using data collected in the US Census of 1990. At the same time, the US EPA also in their website about private wells indicate that according to the US Census American Housing Survey of 2017, there are more than 13 million households in the United States that use private wells. If we make an estimate, a gross estimate of the number of people that 13 million households will serve, that is approximately 35 million people, which diverge in a number of millions of people with what the USGS uses currently. And also regarding population location estimates, USGS scientists estimated that the proportion of people using domestic wells decreases as the household density increases. What does it mean? It means that the number of people who are using private wells in a certain population decreases as the number of households increases in those areas. So that's a very important indicator to take into account. In addition, locations of private wells nationally are not well known. This is important to know to support the private well-related programs at the state and county levels in the whole country. Small area estimates can be difficult to calculate with the current data gaps. We have the last collection of data with regards to water source serving with drinking water to a household was collected 30 years ago. Also, we don't have good estimates regarding the population density changes. Urban areas may overestimate well use, private well use, and estimates in rural areas probably are underestimated due to the population densities which differs in those two populated areas of the country. The total number of private wells and the geographic location of wells is not well known. The gap further restricts the ability to correctly calculate population estimates, especially in small geographic areas. If we take into account the different census populations, geographic areas that the US Census utilized in 1990 and until today, we can see that the census block are the smallest areas for geographic unit information. However, we can have census blocks that can cover up to 150 square miles. So the resolution with regards to the information that we can get from those areas until now offers challenges. In addition, the number and location of both operational and abandoned wells is needed to determine private well water use changes over time. These data are important to target outreach and limited resources to communities at great risk for water quality issues and needed testing. Next slide, please. This is based on CDC Safe Watch program self-experience. We can indicate that monitoring private wells water quality requirements vary by a state in the US. They are linked to real estate transaction acts in New Jersey and Oregon, while it is mandatory in Westchester County in New York. Also, testing can be limited in both number and water quality parameters and scope, new or replaced wells, for example. Data availability can vary by a state, can be with the state health departments or local health departments. And also private well water testing results can be in different units or programs within a state agency, or in different formats or records, like paper records versus electronic records. Also, local health departments may have limited expertise and funding to help private well owners when they have a need for assistance. Next slide, please. From also the CDC's experience of, especially with the Safe Watch program and previous cooperative agreements that we were able to offer to health departments in the country at the branch I work currently, natural contaminants and natural contaminants, excuse me, man-made contaminants and contaminants that can leach from distribution system itself are a challenge in order to identify a contaminant source. Among natural contaminants, we have physical, chemical, for example, radiological agents. We have chemical, mainly arsenic, manganese, and fluoride. And also we have microbial, can refer to bacteria, and protozoa from sources such as wildlife sources. We also have man-made contaminants, and mainly they are related to microbial.
Max, I think you might be on mute. There you go.
Yeah.
Mhm.
Natural contaminants, man-made contaminants are related to microbial contaminants and chemical contaminants, among them pharmaceutical and personal care products, PFAS, PFOAs lately. And also contaminants leaching from distribution systems, like is the case of lead and copper themselves. It is important to note that activities for monitoring private well water quality can be complementary to identification of the contaminant source and vice versa. Next slide, please. We hope that these data gaps identified will enrich the discussion of the groups of the audience in this roundtable. Thank you to the organizers and the attendees of this event.
Up next, we have Lori Rardin from Dartmouth College.
Great, thank you, Reem. Great to know that you're all out there, and thanks so much for joining. And I'm going to talk a little bit about effective outreach. Our focus, as was mentioned in the great introduction from Reem, has been arsenic and mercury. We are a toxic metals program, so in the past we've studied other metals, but over the last 10 years, our focus really has been arsenic and mercury. So my experience will be based on arsenic, but I am aware that we need to look at all contaminants that are occurring in private wells. Next slide, please. So this just gives you a little bit of a sense of the work we've done since 1995, when our Superfund research program began. We are funded by the National Institute of Environmental Health Sciences, which is part of NIH. And our research has informed many significant milestones. Most recently, and one that we're very proud of, is the fact that our research did inform the New Hampshire state decision to reduce the maximum contaminant level for arsenic in public water systems from the EPA standard of 10 parts per billion to 5 parts per billion, making us now the second state in the country, along with New Jersey, to have 5 parts per billion as our MCL for public water systems. And we are hoping that private well users will follow that guideline as well. Next slide. So we are applying our science through this program to improve public health and the environment. Next slide. So in putting this short talk together and thinking about effective outreach, I came up with these kind of 4 areas to think about, and I'll go through each one. And it's important to think, as we're talking about contaminants in private wells and private water, that certainly for arsenic, you can't see it, smell it, or taste it. And for other contaminants, that's the case, like for PFAS. Some are more obvious, and then that often will lead people to get their water tested or do something about it. But out of sight, out of mind is certainly something that rings true. So next slide. So how do we overcome the barriers? There's been a lot of great work done through surveys. We did a survey through a CDC-funded grant to the New Hampshire Department of Environmental Services back in 2014, and I'll say a little bit about that. Columbia, their Superfund research program, has done a lot of great work in conjunction with the New Jersey DEP. So look for those papers. But what we've all kind of determined is there are definitely barriers to testing private water: cost, the cost of the test, the cost of treatment, delivery. How do you get the test kit? How do you get the water samples to the lab? Misinformation, misunderstanding. Maybe you have a treatment system, but what is it treating for? Oh, I think it's treating for arsenic. No, actually, when we go down in your basement and look, it's not treating for arsenic at all. That we uncovered through our survey work, and have heard similar stories from other states. Perception, as I mentioned, if a contaminant can't be seen, smelled, or tasted, then it's not an issue. And maybe I don't want to know because it's easier to be ignorant. And there's a level of apathy too, because we found going forward, after we've identified many of these barriers and tried to deal with them by providing free test kits, providing delivery systems, educating, sometimes those test kits are just not coming back. And so there's something else going on. These 2 pictures that I meant to mention, the wellhead there on the right is to say there's a segment of the private well user population that feels that because they have a private well, their water is pristine and perfect. So they, of course, wouldn't need to test or treat. And then there's also this whole idea of how the public understands information. They want the bottom line, they want the action step right off the bat. Then they'll deal with the supporting information later, whereas typically scientists and maybe regulators fall somewhere in between, go to that background and then ultimately get to the conclusions. I certainly am so much more aware of dealing with the gray area, which we often are dealing with, particularly with arsenic, with PFAS, with these emerging contaminants. I've felt that with this pandemic. What am I supposed to do? How do I behave? No one can actually tell me for sure. We all do it a little differently. And I think there's lessons to be learned for dealing with private well users. Next slide. So another way of getting at effective outreach is using our media, social media, and neighbor networks. We know that we have had effective and increased testing when media has covered stories pertaining to arsenic in well water. We've seen spikes in testing. The neighbor piece is very difficult during a pandemic. And doing a full out media campaign, which I think could potentially very effective, costs a lot of money. And I know a few states have done this and had a fair amount of success. I feel like Connecticut did it successfully and had good results, but that's not something that everyone has funding for. Next slide. Utilizing medical networks is something that we've certainly talked about for quite a long time. And I feel like we're just starting to make some headway there. A recent paper published by Carolyn Murray, who's at Dartmouth with the Children's Environmental Health and Disease Prevention Research program at Dartmouth, looked at several medical practices in New Hampshire and Vermont and did an evaluation of how people followed up with testing based on whether their doctor gave them the test results, whether their doctor gave them the test kit. And it's a really great paper, so I suggest you look it up. I'm happy to provide the citation later on. But it really gives you a good grasp of what is effective. And as you might gather, more people tested when their doctor told them to and gave them the kit. We've been approaching the New Hampshire Medical Society. They're very jazzed up about PFAS. So I am hoping to make some inroads to say, well, there are a lot of other contaminants in water that are important and we know our problems. So let's look at it holistically and try to address multiple contaminants at once. And certainly if we could get an intake questionnaire at doctor visits, if we could get a question on that to include what is your water source, and then if they say private well, then the doctor would say, have you tested your water? That would be ideal. Next slide. So we have done some novel interventions over the years. Right now, New Hampshire is piloting a pitcher program through the WIC program, whereby if the moms who are enrolled have a private well and their arsenic test is at 5 or above 5, they qualify for a zero water pitcher, which does remove arsenic to the levels to very low levels. And so we are excited so far with the results. The numbers we've enrolled has been very low, but as you would imagine, there are lots of reasons for that. But we're looking forward to seeing what comes of this and sharing that with you eventually. Probably DES will be doing that because they're the ones leading the way, our New Hampshire Department of Environmental Services. We've had community distribution events, which have been very successful. And that's a picture of one right there that we did as we worked through our CDC funded grant with New Hampshire DES. And then we have a New Hampshire Arsenic Consortium, which meets every other year and brings a variety of stakeholders together. We hear local presentations from our researchers on arsenic, but also bring people together to discuss the issue of how to lower arsenic exposure for people in New Hampshire. So having that opportunity to brainstorm really has been effective. Next slide. So this is a quick overview of Tuftonboro, New Hampshire, which is one of the communities that did the outreach community testing events. And as you can see, there are 4 years reported here, and their events were the ones in July. And the numbers of tests that were completed gave us a huge increase. So that was a very effective way of getting people to learn more about arsenic and testing and treatment. Next slide, I'm almost done. So we're dealing still with this kind of mentality where we have fake news, false information, but hopefully that will be changing. And I'm just sort of highlighting that as sort of an overarching issue. Next slide. But I think what we need to do is, since there are many different contaminants we have to be considering, we should look at private water protection holistically and potentially use one contaminant that has a higher level of risk perception where people are more worried about it, like PFAS, as a trigger to look at testing and treatment of multiple contaminants. So people get a clear, holistic picture of what's in their water. And then ultimately, as one of the papers out of Columbia suggests, that we adopt a universal well testing regulatory structure where well testing for private water would be required. So that is something to talk about. Thank you. I think my last slide is just acknowledgements. Thanks to all these great people.
Thanks, Lori. Up next is Pierce.
Hi, everyone. Nice to be here, and thank you to the Private Water Network. And my talk today is going to build on both the previous speakers and talk about those treatment concerns and how essentially we connect people who have either a test or have not tested, but hopefully they've tested their water and they've found that they have a contaminant that's above the safe drinking water standard or an advisory, a health advisory, and need to determine what to do in terms of treatment. And this is a significant challenge, as most of you probably know. The process to get to a decision about selecting the right treatment for your home or for the concern that you have, as Lori alluded to, is confounding for a lot of people. As my little statement at the beginning there from Dartmouth, who has been our close partner now for at least 7 years. The installation of the treatment process is complex. And so our department supports, through our private well initiatives, a variety of ways to educate people and help them to select the right technology. However, that's been challenging. And so as part of a 2013 CDC grant, part of that work was to develop the Be Well Informed tool, which is really an online tool to allow a well user to enter in their results from a lab report and be given the correct appropriate treatment. So we have about 1,300,000 people in our state, and about 43 or 44% of those people use private wells. So it's a significant issue in New Hampshire. Next slide, please. So this is one of the survey questions from a survey done by Dartmouth back in 2014, noting that essentially the question is, was it clear what actions you should take, such as water treatment, in response to the test results that you've received? And essentially 1 in 3 people really were not clear about what action they needed to take. One group was the bottom arrow is pointing out those people who are not clear, and those in the middle are saying, well, they weren't clear at first, and then they found some more information and they became clear about what to do. But we field hundreds of calls every year from private well owners, and I can tell you that I think, my personal opinion is there are many people who are very confused and think they know what they're doing, but often are confused about exactly what it is they're trying to accomplish. And there's a myriad of reasons for that. It's not that people are not intelligent, it's just simply there are questions and complexities that they may not consider because they don't have the background. We found, or the survey found, that nearly half of those people who did have some type of treatment for arsenic specifically actually didn't have the right technology that was supposed to, that would be capable of removing arsenic. So there's even this perception of, well, I might have had a treatment system And I think it's supposed to remove arsenic, but it actually doesn't. So quite, big challenges in our state. Next slide, please. So really the simple solution to this is just to try to connect someone who has a lab report that has indicated they have a water quality issue with whatever contaminant, and these contaminants are most of our recommended contaminants that we recommend private well owners do every 1 to 3 years. And they simply have to enter the data, the numbers from the report into this screen, and a report is generated. And we've built a lot of helps into this. A lot of time was spent building in helps to this design to make it easy. In fact, there's a lab report PDF from our state lab, which is the biggest lab in the state, with some annotated instructions on how to actually interpret words like limit, and believe it or not, and other words that just aren't necessarily terminology that people use on a day-to-day basis to help them get the right numbers in the right boxes here. The other kind of thing we've designed into this tool is that most of these are in milligrams per liter, and that's typically the default report unit for at least the state and most of the labs, the state lab and most of the other labs in New Hampshire. Next slide, please. So interpreting the report, your lab report, your result, interpreting a result is important. And what you're seeing in this slide is what they would see in one portion of a fairly brief report, but simply the red X's are highlighting, you've got a problem, and it's listing what they entered in comparison to the MCL, the SMCL, the health advisory, and then a statement in the following column to make this really clear. This is, you're not in a good place with those contaminants that are above the safe drinking water standard, or your level that you entered is fine and you don't need to worry about it. And so the next piece, next slide, please. The next slide they would see is essentially a treatment train, which would include the top indicates the contaminants that you're trying to remove, either arsenic, static lead, stagnant lead, or lead, manganese, and then the appropriate treatment options, sort of delineating whether this is a whole house treatment or a point of use treatment, which is important. There's quite a big difference in cost between whole house treatments and point of use treatments. But how they're installed, how they would actually come to be placed into your house, which conceptually, people also don't really have a great sense of, well, if I have to get a treatment, they don't really have a sense of where it's supposed to go. So this idea of saying, well, okay, these point of use, and you don't see it here, but these are defined a little bit below this graphic, what point of use versus whole house means. So should be fairly obvious, and we do have feedback loops for this tool, and we don't get a lot of questions about this, but the important thing here is that people are seeing the appropriate treatment technology that would take out and remove the contaminants of concern that they've entered in from their lab report. So they're getting a proper and correct technology, which is another problem. It's that they either select or they talk to someone who isn't correctly advising them on what the appropriate treatment should be. Next slide, please. So for New Hampshire, we are still a relatively small state, but the BWell tool has been published since 2015. And initially, after it was published, we did do a lot of promotion to get this connected to all of the other labs. A lot of our labs in the state put a link in their digital reports to the app, so people get their report either email or it's sent out on paper, and they can go and find the app and type in their results and get a treatment summary that they can save and they can share with a treatment company, a water treatment company. The numbers, to put them in perspective, we have about the largest lab in our state issued 2,000 lab reports over the last calendar year, or the last 12 months. And so about 1,000 people entered their results into the BWell Inform tool. So it's hard to say what the full universe is, but it seems like a fairly significant number given the number of issued reports by the largest lab in our state. And we've seen, as was mentioned earlier, there are some states that have adopted this tool, a few listed here and a few others that aren't listed. And it's being implemented by EPA, or was implemented by EPA, and is now being implemented by a nonprofit organization to share this technology in the code, so states and other governmental entities can adopt the tool for and modify it for their own purposes. Next slide, please. So just to wrap on sort of this idea of what's a limitation and what's an opportunity here with treatment, we, like most states, as was mentioned, do not have a requirement to either test or treat private well water. So we're already at that point of having to encourage and persuade people in our state who have a private well to test and treat their water if necessary. And so that's a policy decision, which we do have guidance around for municipalities and have talked with state leaders in their legislature. It's a difficult issue to mandate private well testing in many places, including New Hampshire. It's not something that's we're quite ready to do. The cost, as was also mentioned, is significant, which is, we have tried to identify lower income and people with limited means and be able to offer assistance. And some of that assistance is available through federal programs like the USDA 504 program, which we do promote. And we are directing resources through a specific trust fund to help and consider actually helping people who have lower incomes. But that cost is a significant factor. And so our tool is actually, I would say, somewhat leaning towards where you can get away with point of use treatment, like for arsenic using reverse osmosis. Our tool is suggesting that to ensure, to try to get around at least this issue of having to have a very expensive treatment for removal of arsenic. We also don't have any oversight at the state or local level for the installers. So for folks who are installing treatment systems and conducting maintenance, we don't oversee that, and there are no state criteria for being an installer. And so this certainly opens up this question of, are residents with private wells being served in a high quality way, where their interests are being served from both a public health standpoint and from an economic standpoint. So of course that could lead to a licensing and a certification program for installers, which we don't have per se. We have something that there is a it's not an accreditation program, but it's more of a program you can sign up for as an installer to, that's more of a volunteer thing. It's not really, testing and going through a quality assurance for their services or their staff. But so those are some limitations and some opportunities around treatment in New Hampshire, and I'm sure in many other states as well. Next slide, please. I think I'm done. Thank you.
Great, thank you. Thank you to all our speakers. Your presentation really helped sort of set the stage for the discussion. Again, just as a reminder, we are hoping to have an interactive roundtable discussion today. So I would encourage you to either, notify me if you'd like to speak up. I can unmute you. I could do that as host, or if you want to share your thoughts, comments, questions on the chat box, you're welcome to do that. Or you could also use the Q&A box. So lots of options, whatever you're most comfortable with. And I had provided a SurveyMonkey link along with the notification for this roundtable discussion. So some folks have submitted some questions already. So thank you to those who did submit, and let's go into it. So our first question, even though a lot of these challenges that we've talked about are sort of interconnected, I think we'll begin with Max. All right. So, obviously, over 15% of the American population relies on private wells as their primary source of drinking water. Um, and there are no federal quality requirements for these water sources, yet there are major gaps based on your presentation in terms of our critical knowledge that obviously hinders our national efforts to reduce or eliminate diseases that might be prevented by better managing environmental factors. So, my question, Max, is some of this you have alluded to in your presentation, um, but are there any additional data, ones that you did not mention outside of, the locations of the private wells, the estimates for the private well users, testing, and exposure to regional contaminants? Are there any other data that needs to be collected so public health professionals could better monitor and communicate the potential risks to private well users and demonstrate the need for policy or data driven policy interventions? Um, and to what extent is this work happening nationwide?
Yeah, thank you very much, Rim, for the questions. You know, we have clear that there are no national at the moment incentives to acquire data with regards to water quality, private well water, and that's in both in terms of like where are they and what is the water quality that they have. And those two questions are important to answer, and hopefully that the efforts that I see, New Hampshire is doing, an institution like Dartmouth is doing, I think are very important together with others in the private water network, for example, states and health departments that were part of the Safe Watch program at CDC are unfortunately isolated efforts with very little support, very little funding. But I think working together, we can make a force in order to gain attention at maybe state legislatures, national legislatures, and say there is a need because there is an important number of people in the United States that are drinking water provided from private wells. It's also very important to know that there are different agencies that are working with this. We all know that the US Geological Survey does work on this. EPA has an interest in working on this. CDC, we have interest in working on this. And I see also private sectors interested in doing this. So I think the private water network can help us to work further in tackling these gaps that were identified, from data gaps to treatment gaps to all the challenges that private well users are facing. I hope I address your question. It's a very good question, but it's not very easy to answer.
No, I hear you on that, Max. Thank you so much for that. Um, Lori, I've got a question for you. So you've mentioned a lot of the big challenges in terms of doing effective outreach based on your experience with Dartmouth's program. But how do you measure the effectiveness of your outreach efforts?
That is a very good question. The best way to measure it is there we go. Good question. Assuming that our goal is to increase testing and ultimately treatment, then the most effective way to test our outreach is by the number of test kits that are requested and completed. And as I noticed a question in the chat box is how do we know how many tests are completed in New Hampshire? We only know the numbers through the New Hampshire State Lab, which Pierce mentioned. We don't necessarily know the numbers that are coming through private labs. So in New Hampshire, unlike other states, we're a bit handicapped in that regard because we don't have a way to track the tests that are taking place as we would like to be able to. I think that's the best measuring tool. And so it's kind of dependent upon, you know, who your audience is initially for the outreach you were doing and what your goals are. But assuming that's the case, then the number of tests that actually, if you can measure it, sometimes it's more difficult to be able to measure. If you're doing, say, a social media campaign, you can't be absolutely certain unless you follow up with a survey of the actual people who originally got the information. So it all depends on how controlled the effort is and that you build in that measurement system from the start. I hope that answers the question.
It does. Thanks, Lori. And thank you so much to the both of you, Pierce and Lori, for responding to the questions on the chat box. Just a quick comment. I see some questions about whether or not we will be sharing links. I know there were some links that were referenced. Pierce referred to some, Lori as well. I will make sure that I will collect all of them and you will receive a follow-up email. Anybody who registered for this roundtable will receive that, so that will come to you, I promise, but I may not be able to provide that to you right away. Mary Eggers has a question. Anyone know of any good options for families with multi-contaminant well water who cannot afford the usual water treatment technologies? Anyone want to take a shot at that?
Pierce?
I just wanted to clarify. So is the question, are we aware of cases where there has been multifamily rentals which have not been able to afford treatment? Is that what the question is?
It sounds like it.
Yeah. I mean, no, I haven't been dealing, and we don't ordinarily, I mean, those questions have come in occasionally, and we have considered rental properties in legislative proposals for testing for that have a shared private well that they use as a primary source of drinking water. In terms of legislative efforts, that hasn't gone very far for requiring a regular testing, although, you know, in our state, when there's a real estate transfer, certain tests have to be disclosed. Results of any past tests have to be disclosed. So, but in terms of affordability, again, in our state, we would probably either defer to the to programs like the 504 program, which does have low income guidelines for assistance through grants or loans, to include private well systems. So we could in those circumstances, those folks who need assistance can get money through that program. And New Hampshire is just starting to have a conversation around some funding we have in a trust fund for drinking water to address this question of people who are having trouble with affording treatment, but we haven't really moved forward with that just as yet.
And certainly this idea of using water pitchers that are certified to remove the contaminants of concern is something that I would say we are looking at carefully as a temporary solution. So that's a lower cost option, and it presents its own set of issues, kind of. So that's another option to consider.
In the experience of Safe Watch program at the CDC, there were a number of states and some local health departments that also serve as a resource for people facing these types of issues. In the absence of a national legislation that will protect users of private wells in the country, I think the health department becomes a resource. If they cannot help directly, they probably will link people facing these issues to somebody who can help them.
Excellent. Thank you so much for all of your input. Pierce, I've got a question for you. So, the Be Well Informed tool, I think that's an excellent tool. The Private Water Network has actually featured a webinar on this, I believe, last year. But I am curious to know, how can other health departments use this tool? You mentioned that there are 12 other states, I believe, that are developing a similar tool for their jurisdictions. How can other health departments use this tool, and in what way would the tool work for them, and in what way would it not work for them if they use the New Hampshire one, if that makes sense?
Right. So no, it wouldn't probably make sense for other states to just to adopt and take the code and try to work with their IT people to set it up, or to refer people to our tool, only because the standards, although many of the water supply standards or drinking water standards are similar across states, there likely are differences. For instance, we have differences for perfluorinated compounds, and that's those are some of the entries you can put into our tool. So so options for other states and local health districts, I think you can port this code. You can take this code. It's written in XML and is on a system. When we designed this system, part of our pledge to CDC was to make this transferable, and that's why other states have been able to do it. And there is the Environmental Council of States, ECOS, which is now about to launch a website that will allow access to and work with I think states to adopt the code and refine it and change it for that state for their purposes and use. So that's actually just been started, and I don't know if it's actually available at this point, but I think Reem, I provided you the information to the Environmental Council of States, and as time goes on, that organization should be a resource for other states, and then by extension local health departments who could benefit from use or adoption.
Great, excellent. I'm sort of debating if we should take one last question before we wrap things up. Pierce, we did receive a question quite early on for treatment concerns. The question is, what are cost-effective options for private well owners with high total dissolved solids, high hardness, high metals, who cannot afford to install and maintain traditional water treatment systems?
Well, that's not an easy question, but typically, that's a whole house approach, where if you're going to have high metals or solids, most people are going to want those removed prior to moving through their heating and plumbing systems. Typically, that can involve a filter or some type of a filter. In some cases, that's reverse osmosis. It's really not, it's not. In terms of cost effectiveness, I think if that's the question, that's a hard one, because most systems that are going to address a whole house approach would involve a series of tanks and plumbing and installation of filter and media. So it's well over, typically over $1,000 for just getting started with a system that would handle hardness or metals and things of that nature. So I don't really think there's a good answer to that. If there's somebody in the community who's had some experience with treatment and engineering systems to do that for at a low cost, I think that's a good. I mean, certainly, if you have hard water, you're talking about a softener. So you're talking about some type of a cation exchange system, which again is not going to be a few $100s. It's going to be, especially for a professional system to be installed. So unfortunately, I guess it partly depends on what cost effectiveness really means in this context. But certainly, most of those whole house systems are going to be over $1,000, and for people who have limited means, it's going to be a stretch for them to install and then maintain it and pay for the chemicals and do the maintenance or have someone else do it.
Great, thank you. And with that, we're out of time for our session today. So I just want to thank all the speakers who took their time to share their expertise with us. Thank you so much. Thank you to the attendees for participating, asking your questions. As a reminder, please do take the Private Water Network annual survey to help us plan for the future events and improve the program. Your feedback is very important to us. And thank you again for joining us. We will see you next time.